Hi again, Rachel here, Executive Director, she, her pronouns. I'm here to talk to you a little bit about funding. So one question that we've been getting is OCRCC's funding currently at risk? Yes. No. Maybe, probably. Definitive answers to this question require the gift of prophecy, which I just don't have. I want to kind of connect the dots for y'all about what we do know. In late January, the entire nonprofit sector was sent into a frenzy when it appeared that the president had ordered a full stop funding freeze on all federal grants and contracts. So while this effort has been halted by the courts, the specter of a full federal funding freeze is still in the back of our heads as we plan for the near future. I want to clarify what these grants and contracts really are. These are not handouts. Federal grants and contracts are the mechanism by which the federal government contracts with local experts to deliver on their obligations to the citizenry. They contract with us because we know what we're doing, we do it better, and we do it more efficiently. The National Center for Nonprofits estimates that in order for the federal government to do all of the things that they contract with nonprofits to do, they would have to grow their budgets and their staffing by 2.5 times. So anytime there's a conversation about government inefficiency, I want to be really clear that the reason they contract with us at OCRCC and other nonprofits on the ground is because we perform the services better and we are geniuses at stretching a dollar. We do it more efficiently than they can. Let's get back to what the funding outlook is for OCRCC. When we talk about federal funding, what we want our community to know is that roughly 50% of Orange County Rape Crisis Center's funding is sourced from grants and contracts with federal backing. Now that's relatively high in the nonprofit sector, but it's actually really low in the victim services sector. Many of our neighbors and colleagues across the state are much more leveraged on federal funding than we are. So this is a really scary situation for the entire state of North Carolina. Of that half of our funding that is federally backed, the majority of it, a little over 60%, is for projects that explicitly focus on targeted communities that are named or implicated in the most recent executive orders. That includes projects that are specifically focused on LGBTQIA+ survivors, as well as Black women survivors. If the Office on Management of Budget, or OMB, if they use the highest level of scrutiny available to them, then these grants are at risk, for sure. And they could be at risk as early as this summer. Now, the remainder of our federally backed contracts do not specify work that is currently under scrutiny by the OMB based on the DEI framework. They're still at risk for other reasons. So let's zoom out a little bit to get some context. If you've been around and following Orange County Rape Crisis Center for the last 4 years, you've probably heard us ring this bell before. And that is because victim services have been the canary in the coal mine of government disinvestment for about 5 or 6 years now. So between 2018 and 2024, VOCA and VAWA, so VOCA is the Victims of Crime Act, VAWA is Violence Against Women Act. These are the two primary sources for federal funding for victim services in North Carolina. These two pots of money have decreased a total of about 70% over 6 years. The Governor's Crime Commission, which is the state agency in North Carolina that administers the VOCA and VAWA funds to all of the victim services orgs. And they let us know that from fiscal year 24-25 to 25-26, so in 1 year, we should anticipate a 90% decrease in available funds. From 1 year to the next, the entire state of North Carolina is going to have to share 10% of what we shared the previous year. This is the backdrop against which these new threats to federal funding are coming. I feel pretty compelled to point out that the work of ending sexual violence is inherently political, and it engages strategies that are offensive to the ideology of the people who are currently in charge of federal funding priorities. Anti-rape programming has already been suspended in multiple branches of the military because they were able to successfully link it to the DEI framework. While no government official has come out to explicitly say that victim services are at risk, the president has already named nonprofits generally as a target because of our supposed wasteful and harmful practices. Let's be real, there are documented sex offenders at the table creating these priorities and creating these plans. And this includes people who have have repeatedly demonstrated that the law is not a sufficient protection if you happen to be standing in the way of something that they want to do. All of those dots connected, I think it would be really foolish for us to assume that we're safe just because we're a mainstream organization and not a culturally specific organization like some of our neighbors who are in existential crisis at the moment. The obvious next question is, can OCRCC survive a federal funding cut? Yes and no. The robust constellation of services that OCRCC currently offers to survivors, it's certainly not possible to sustain that on local investment alone. So in the event that OCRCC needs to scale back services due to federal funding cuts, local and state investment could support about half of our current capacity. Basically like saying of the 900 survivors that we served last year, 450 of them might not be able to get services. So here's a few scenarios that a sudden funding loss could mean for us. One would be cuts to prevention. If we were forced to cut our beloved and award-winning Safe Touch and Start Strong prevention education programs that operate in local schools, that leaves about 12,000 children and adolescents more vulnerable to child sexual abuse, teen dating violence, and sexual assault. Nearly half of all people who will experience sexual violence in their lifetimes endure their first sexual assault before the age of 18. This is a very vulnerable group who are facing the possibility of not having prevention services. Another group is our therapy clients. We currently have 45 people who are high risk, high intensity clients that are in treatment for PTSD resulting from their sexual assault. If we had to cut those off mid-therapy, that would be deeply detrimental to their mental health. Support groups is another place where we might have to make cuts. Support groups is a place where survivors, even 10 plus years after their initial assault, after suffering in silence for years or decades, can finally come together and experience and provide mutual peer support, which is indicated for reducing negative impacts of sexual violence like substance abuse, suicidality, and self-harm, the passing along intergenerational trauma. Our support groups have an 80+% success rate in halting these things and increasing coping skills, decreasing isolation for trauma survivors. Those might have to go away. And let's talk about advocacy services, because this is where a lot of our funding goes, and these are the types of services that are at risk. If somebody is working with an advocate on their case, they have access to a litany of services, things like 24-hour crisis support, navigating the criminal justice system, victims' rights notification, customized referrals to other services, accompaniment for high-stakes appointments with DSS, with employers, with attorneys, with school officials. We provide accompaniment to emergency medical care, for forensic exams, law enforcement interview accompaniment so that you don't have to sit and talk to the cops all by yourself, immigration assistance. We help with filing U visas and T visas and helping people with pathways to citizenship, interventions with employers. If you got to go and have a meeting with HR about the time that you've been missing due to your trauma, we can be there with you. Child and dependent care assistance, transportation assistance, interpreter assistance, crisis intervention and safety planning, emergency financial assistance to stabilize financial crises, emergency shelter, safe house placement, transitional housing, relocation services, installing security systems at your apartment, assistance with restitution, assistance with family law issues, criminal advocacy and accompaniment to your own court cases, helping you get a restraining order. In 2024, OCRCC staff provided nearly 3,000 unique services under this program. The prospect of cutting that back by 50% is honestly mind-boggling. It's really hard for us to wrap our hearts around. The other side of this answer, of course, is that rape crisis centers were created because the government wasn't paying enough attention to survivors' rights, safety, and dignity. We existed before federal investment. We will continue to exist after federal disinvestment. Some version of the OCRCC will continue to exist because people like you believe that it's a priority. But let's be real, the version of the center that exists in this future that these executive orders are painting, it's going to be entirely dependent on the degree to which our local community makes it a priority. And when I say local community, I'm talking about individuals, schools, faith communities, private businesses, local government. We are all a part of this local community, and OCRCC is going to survive, but only to the extent that this community decides it wants it.